member from South Surrey, White Rock.
Crime, chaos, drugs, and disorder. That's what we have after 9 years of this NDP Liberal government. The extremist policies of this Prime Minister have forced parents in British Columbia to protect their kids from used needles at the playground. Open, in-your-face drug use in Tim Hortons, on the SkyTrain, even in our hospitals. The Prime Minister's negligence is killing our citizens. When will he admit that his radical decriminalization experiment has failed and end it?
The Honourable Minister for Mental Health and Addictions.
Mr. Speaker, too many Canadians are dying every day from an ever-changing illegal toxic drug supply. The opposition leader and members of the Conservative Party are a big talk about investing in treatment, but Conservatives cut 2/3 of the drug treatment fund when they were last in government. Shameful. Let's talk about what saves lives, Mr. Speaker. Safe consumption sites, accessible social and healthcare services, prevention, treatment, and harm reduction. They have no plan, Mr. Speaker. On this side of the House, we continue to work to save lives.
The Honourable Member from South Surrey, White Rock.
Well, let's talk through a clear lens, Mr. Speaker. 40,000. That is the number of Canadians that have died from drug overdoses since 2015. Entirely preventable. Last year, BC set a record with over 2,500, and they want to talk about saving lives and compassion. Premier Eby and this Prime Minister have failed British Columbians, and now he's taking his deadly experiment to Toronto. Until this extremist drug policy is dismantled, people will keep dying. Will he prioritize recovery and stop killing Canadians with his radical ideology?
The Honourable Minister of Mental Health and Addictions.
Mr. Speaker, the opposition don't want to talk about the plans or the tools that are needed to save lives because they don't have a plan. All they offer Canadians are slogans and fear. Slogans are not an evidence-based strategy, Mr. Speaker. They are just words. We have a full suite of measures that address this crisis because it's a public health crisis, Mr. Speaker. It is not a criminal issue. We continue to work with BC on the exemption that they requested with a clear lens of public health and public safety.
Good job, yeah.
The Honourable Member from Fort McMurray, Cold Lake.
Mr. Speaker, this NDP-Liberal Prime Minister is not worth the crime, chaos, drugs and disorder. After 9 years of the Prime Minister's extremist policies, public drug use has become the norm. The Prime Minister has made it legal in British Columbia to smoke meth on the beach beside a family or smoke crack in a hospital beside healthcare workers. In fact, a nurse in British Columbia stopped breastfeeding her twin girls early at 13 months because being exposed to illicit drugs in the hallway. When will the NDP Liberals realize that time is up and end the decriminalization today?
The Honourable Minister of Mental Health and Addictions.
Mr. Speaker, every life lost in the illegal toxic drug supply, every overdose, every family that loses a loved one is a tragedy. Right. Mr. Speaker, our focus, working with the BC government on their exemption request, is about saving lives, about providing health care. Harm reduction is health care, Mr. Speaker. Treatment is health care, Mr. Speaker. Prevention is health care, Mr. Speaker. Enforcement is also part of the plan. We continue to work with law enforcement in the provinces. They continue to divide.
I'm going to ask the member from Northern Rockies to please make sure that he only takes a microphone when he is recognized. The Honourable Member from Fort McMurray, Cold Lake.
I'm sorry, Mr. Speaker. Drug deaths are up 380% in BC since 2015 when they took office. So the NDP Liberal Coalition unleashed a horrific experiment in British Columbia, and now the NDP Premier is pleading with the Prime Minister to fix this disaster. But what we're learning is the Toronto minister has decided they're going to double down and they want to expand this failed project into Toronto. After 9 years, this NDP Liberal government's drug policy is failing Canadians, and the Prime Minister is not worth the cost. Instead of expanding this, will they do the right thing and just end this policy today?
Minister of Health.
Mr. Speaker, around the world, opioid deaths are taking so many lives. The only way we can rise and meet that moment is with truth and evidence, and not inflaming through spreading false information this situation. I would ask the member opposite, instead of trying to seek opportunity to attack in this House, to work collaboratively on evidence-based solutions that save lives. Like her, like every member of the House, when a life is lost, it rips us all apart, and we have to meet it with truth and honesty and set aside partisanship, Mr. Speaker.
The honourable member from Caribou, Prince George.
Mr. Speaker, overdose is the leading cause of death in my province of British Columbia. This NDP-Liberal Prime Minister's extremist drug policies have turned our neighbourhoods into war zones. Hard drugs are being used in playgrounds, coffee shops, and even hospitals. Last week, a drug-addled man lit fires and consumed drugs in front of traumatized kids at the Prince George Aquatic Centre. The RCMP were called numerous times, but their hands are tied because of their insane drug policies. Will the Prime Minister end his deadly drug decriminalization today?
Hear, hear.
The honourable Minister of Health.
Mr. Speaker, I would ask clearly, what evidence are they basing their decisions on? And the answer to that question,
the honourable minister has 25 seconds left on the clock.
Mr. Speaker, replacing science with slogans, replacing research and evidence with talking points will not fix this problem, Mr. Speaker. There is not a person in this House who is not ripped apart when we watch somebody lose a loved one to this crisis. But to meet it with partisanship, to meet it with pretend solutions, to do things that have failed in other jurisdictions is a disgrace to those who have lost family members, Mr. Speaker.
The honourable member from Cumberland Colchester.
Speaker, this NDP-Liberal Prime Minister is not worth the crime, chaos, drugs and disorder. After 9 years, this Prime Minister's extremist policy allowing for deadly hard drugs to be used in public spaces such as parks, coffee shops, beaches and hospitals. A leaked memo in BC is now instructing nurses to teach patients how to inject illegal drugs into their intravenous. Jeez. Will the Prime Minister end his deadly drug decriminalization experiment today?
The Honourable Minister of Mental Addictions and Health.
Speaker, on this side of the House, we are committed to saving lives and making sure people who use drugs don't die alone. We moved forward with a decriminalization pilot project at BC's request and have always maintained it would be rigorously monitored and adjusted as needed. We know a full suite of tools, including harm reduction, are needed. Even the MP from Caribou, Prince George, knows it. He said himself, quote, "I asked if safe injection sites were helping. They did say that safe injection sites probably do help." Mr. Speaker, every tool, every resource to save lives is what we are committed to.